The truth about REBT, addressing criticisms and unveiling its power. Rational Emotive Behavior Therapy, REBT, is a form of cognitive behavioral therapy developed by Albert Ellis. While REBT has been widely praised for its effectiveness, like any therapeutic approach, it has also faced criticism. Here are 8 common criticisms of REBT and detailed responses that logically address each criticism. 1. Overemphasis on rationality. Criticism. Some argue that REBT places too much emphasis on rational thinking and may not adequately address the emotional aspects of human experience. Response. REBT acknowledges the importance of emotions but focuses on changing irrational beliefs that contribute to negative emotions. It emphasizes that irrational thinking leads to unhealthy emotional responses and aims to help individuals develop more rational perspectives, not to suppress emotions. 2. Blaming the client. Criticism. Critics claim that REBT can be confrontational and may seem to blame the client for their problems by identifying irrational beliefs. Response. REBT does not seek to blame but rather to help individuals take responsibility for their thoughts and emotions. It encourages clients to recognize and challenge their irrational beliefs in a supportive therapeutic environment. 3. Simplistic ABC model. Criticism. Some argue that the ABC model, activating event, beliefs, consequences, used in REBT oversimplifies the complexity of human cognition and emotions. Response. The ABC model is a simplification, but it serves as a framework for understanding how beliefs influence emotional reactions. REBT therapists use it as a starting point, incorporating additional techniques and strategies to address the complexity of individual experiences. 4. Cultural sensitivity. Criticism. Critics suggest that REBT may not be culturally sensitive and that its emphasis on universal irrational beliefs might not apply across diverse cultural contexts. Response. REBT is adaptable and allows for cultural considerations. Therapists can modify the approach to be culturally sensitive, recognizing that irrational beliefs may manifest differently across cultures. Ellis himself acknowledged the importance of cultural nuances in the application of REBT. 5. Neglect of childhood and past experiences. Criticism. Some argue that REBT's focus on the present and future may neglect the impact of childhood experiences on current beliefs and behaviors. Response. While REBT prioritizes present thinking, it doesn't ignore past experiences. Therapists using REBT often explore how past events may contribute to irrational beliefs, helping clients understand and reevaluate the influence of early experiences on their current thought patterns. 6. Excessive cognitive focus. Criticism. Critics contend that REBT's heavy emphasis on cognitive aspects may neglect the importance of emotional expression and experiential processing. Response. REBT recognizes the role of emotions and encourages their expression. It focuses on changing irrational thoughts as a way to influence emotions positively. Therapists using REBT often incorporate experiential techniques and encourage clients to connect cognitive restructuring with emotional experiences. 7. Lack of empathy. Criticism. Some argue that REBT therapists may appear overly rational and lacking in empathy compared to therapists using other approaches. Response. Empathy is integral to effective REBT. While therapists may challenge irrational beliefs, they do so empathetically, fostering a collaborative and understanding therapeutic relationship. REBT aims to help clients feel understood and supported in their efforts to change irrational thinking. 8. Overemphasis on directive techniques. Criticism. REBT has been criticized for its directive nature, with therapists actively disputing irrational beliefs, potentially making clients feel pressured. Response. While REBT can be directive, therapists also collaborate with clients. They work together to identify and challenge irrational beliefs. The level of directiveness is adaptable to the client's preferences, and therapists are encouraged to adjust their approach based on the client's responsiveness and needs. Interested in learning more about REBT? Consider going to the website of the Albert Ellis Institute, and read about its many educational and training programs.